LinkedIn, Instagram, as well as YouTube on this Figured Out Friday. We're so excited to have you in the Coaches Cafe. For those that don't know you, I am Regina Lacking, your plant-based boss and your certified LCSW. I pull up every Friday to bring you news that you can use as it relates to making impactful decisions around your everyday health. It's not the big things that we do, it is the everyday small things. And so today, I am super excited to have a new partner, new friend in the Coaches Cafe for Figured Out Friday. I'm going to do a brief introduction. And if you are on Facebook, you're going to want to hop over to LinkedIn or YouTube, doing like well with Regina, so you can see her lovely face and enjoy the full conversation. So thank y'all for pulling up. Thank y'all for joining. We are so excited. Hey, good morning. Good morning. Thank you for joining. Look at you. Come on in, YouTube. Come on in. I'm going to do a brief introduction of my amazing guest. Y'all, when divine connections happen, divine connections happen. So super excited to hear and let you all hear how we met and some things that we're excited about, because we are really, really dedicated to helping as many people as possible to transform their health. One thought, one meal, one opportunity at a time. Because if we're still here, y'all know what I believe. If it's preventable, then it's reversible. And so we then have a charge to recover the recoverable. And I believe that our health is absolutely recoverable. And so it's not too late, regardless of how old you are or if you've had a cardiac event. What you're going to hear today is that Essence has had a cardiac event and her heart is in cardiovascular work. So doing amazing things in New Orleans, Louisiana, and around quite a few other states. So let's get in and introduce you all to Miss Essence Banks out of New Orleans, Louisiana. Can't wait to get back down there. And so today I'm so excited because Essence is a true phenomenal leader in the community, a true change maker. She is an advocate for heart health. And you all know I share a lot of statistics in regards to cardiovascular health. So to have someone who has walked through it, it's just an honor to have this conversation, this very real and necessary conversation. Essence Banks is an accomplished organizational leader with over 15 years of experience leading strategy, talent development, and transformational initiatives that you're actually going to hear about. She's worked with organizations including Entergy, Marriott International, and Four Seasons Hotel and Resorts. But here is why I have her here. Here is what warmed my heart when I was in New Orleans a couple of months ago. Essence is the founder and CEO of Heart in Hands. It's a nonprofit organization that has educated and empowered over 10,000 girls across 6 cities through heart health education and wellness initiatives. I could go on, but I am going to get into this conversation. She's the CEO of Heart and Hands, a nonprofit organization based out of New Orleans, Louisiana. We're so excited to have you in the Coaches Cafe on this Figured Out Friday, where no one has to figure it out alone. Welcome to the Coaches Cafe, Essence. Let's get this conversation started. How are you this morning?
I am great. Good morning. Thanks so much for having me.
Yes. So I know one thing about people, and they want to hear information. We're going to share information. But what I want to do first, Essence, you have a couple of events coming up at the end of the year. And everybody's not going to stay to the end, to see this conversation. So I want us to go ahead and talk about 2 major events that you have coming up in New Orleans that supports Heart and Hands. And so after, what I want to do is in this conversation is, you share about Heart and Hands, and then lead into sharing about those two specific events, and then we'll roll into our conversational interview. That's what I would love to
All
do.
right. All right,
Yes.
sounds great. So, as you know, Heart and Hands is a now international nonprofit that
All right.
focuses on girls aged 10 through 18. We focus on heart health, heart disease prevention, and creating generational health. And so that is our core mission for Heart and Hands. We do it in some really fun, creative, innovative ways, but it's really all about catching heart disease before it happens. So you can imagine from 18, that's the spot and that's the age where we really
Mhm.
want to make sure that our girls are educated, they're aware. We focus on prevention and early detection, and that the health of your heart is totally in your hands. So, overall, that is the core mission of Heart and Hands. Started Heart and Hands in 2014 because I was at the time, 10-year heart disease survivor. And I thought, how do I get ahead of heart disease with our girls and women, since heart disease is the number one killer of women? And you mentioned it in the intro that it is 80% of heart disease. So that is the population that we are focused on with hands. And so we do several. So I did want to touch on that as well. So in September, we have Heart Gala, which will be at Carlton, New Orleans, downtown New Orleans, at the beautiful hotel there. And so that event really highlights the accomplishments and achievements of our girls throughout the year, the impact that we're making with our girls, with their. It's all about ensuring that families are along with them to kind of celebrate their key successes and things that they have done so well working with Heart and Hand. So that is the gala September 12th. And then we also have Running for the Heart 5K, 10K. And that is an event that started and was birthed out of COVID because, everyone was home.
Mhm.
Um, and we thought, you know what, let's get outside and run. There was nothing else to really do. So we started training, we started walking. So it's for every level: walkers, runners, joggers. If you want to roll, you want to stroll. It's open to everyone. And that is a Saturday, November 7th, here in New Orleans along the beautiful bayou near City Park. And so all of that information obviously can be found on our website, which
Mhm.
is heartinhands.org. So we would definitely love to see you out there. Visit our website, follow us on social media as well to find out more information about not only those two events, but all of the things that we're doing throughout the year with our communities across the United States.
And that's how I met you at a community event. And so it was such a beautiful time at one of the community centers in New Orleans, really trying to continue to address the health disparities. And so we do that in community, and having the opportunity to meet you, engage with you, and learn, because my focus and the majority of the focus that I am familiar with, we tend to focus on adults. And when your teammate snatched me up to come take a picture with the sign, I had an opportunity to just listen to her, share more information about the organization. And she was like, I need you to sign up right here. And just to know that, you know what, I've not thought about that age group. So if we can do some real preventative work between 10 and 18, then prevent the adult chronic heart conditions to the degree that we can. Oh, the the age group, the target population. So you all meet the students where they are and make this thing fun. So that's what I was. They are having a good time. Like it's a 1 mile walk. Okay, so I'm in Mississippi trying to figure out how can I pull up on a Thursday evening for this 1 mile walk, and it's just those things. being intentional with supporting our young people to let them know, you know what, it's fun, it's okay. You don't have to be on a video game, or you don't have to be, doing something else. That the fact that if we start with our young people, your target age group is 10 to 18. That's a very powerful age group to put in community, because we also know, and it's a freebie on a Friday, the rate of suicide is very high in our teenagers and our young adults. And so having them in community where there are eyes on them creates an opportunity for us to continue to love on and nurture our young people. And so, Essence, let's get into it. So, when I was reading your bio, I was like, this lady right here, okay, is just a gem. And I gotta ask, like, before the titles, because you have awards, you have all sorts of accolades, you have a national recognition. Tell the people, who is Essence Banks?
I love that. So I am a native of New Orleans, right? I love, love, love everything about, our beautiful city. I am a wife. I am a mother. I am a daughter. I have two sons. One is 25 and the other is 12. So, I have a little age gap there. But it is beautiful. It definitely keeps me young. It keeps me on my toes. And I am all about community from a very early age. I have always wanted to give back and have found different ways to do that, right? From elementary school through high school, through college and beyond. And so I think it's just a perfect fit that about 12 years ago, I started Heart and Hands to do more of that work in community, bringing our young people together and really just focusing on their overall health and wellness, right? So, Heart and Hands is the only organization that focuses on the girl and her heart. And so, as I mentioned, there's several different ways that we do that, and I definitely want to share some of the programming. But when I think about the work that I've done, what led me here was also I am now a 22-year heart disease survivor, or I say thriver, right? So at the
Yes.
age of 30, I was diagnosed with coronary artery disease. And so I think the major story there is I didn't have any of the typical symptoms. So I didn't have
Mhm.
high blood pressure, no cholesterol, no diabetes, was never overweight, never smoked. So I didn't have the risk factors that our doctors are saying, make sure we keep these under control. I was
Mhm.
experiencing shortness of breath, heart palpitations, and thought, something's just not right. Finally went to the doctor, and they ran several tests and said, yeah, nothing is wrong, you're fine, take 3 days off
Mhm.
from work. They even
Okay.
tried to prescribe Xanax, and I thought, wow, no way, it's
Well,
something more.
mhm.
Yes. So as a result of me being very persistent and pushing, I found a cardiologist that finally listened to my symptoms, and then he took over and ran several tests, and then found out that I then had 98 and 95% blockage in two arteries. So I was in shock, 30 years old, in the prime of my life,
30.
you 30, not having any symptoms, as far as risk factors, that is. No risk factors
Right,
at
right.
all. And so when I go into the doctors, of course, they're like, you don't look like someone that has heart disease, right? The things that you're saying and the symptoms doesn't sound like heart disease. So they kind of pawned it off on some other things. They said it's stress, you're having panic attacks, take 3 days off from work. Um, but as I was very persistent about just something is not right during my workouts, I was not feeling right. And we know that symptoms for women present differently than men. And so back then, doctors were looking at it as like the old person's disease, the older, like a man's
Mhm.
disease,
Mhm.
definitely not a young woman coming in that was fit. At the time, I was a personal trainer, dancer, and all of these things. So that story well, my personal journey with heart disease led me to really focus on women for that first 10 years. I was speaking everywhere, talking to women, and really just trying to encourage women to take care of their overall heart health, right? And so that includes things like stress. We know stress is a huge factor in cardiovascular disease and what it does to the heart.
Mhm.
I talked a lot about just being women and carrying so many bags, wearing so many hats, and all the things that we do, we're the mothers, we're the wives, we're the caregivers, we take care of the family. And so that plays a significant role on your heart health as well. So I started doing that. And then I thought, yeah, it's time to get to the girls. If I really want to prevent heart disease and catch it before it hits, the adult women, I'm going to get to the girls. So when they go up to college and they're ready to take care of their own families, that they are equipped with the information now, right? And again, we mention these little things, it's very small changes that we encourage them to make every day that can change the trajectory of your heart health forever. And so those are like the key messages that, we share with Heart and Hands when we are working with them. And so that's kind of a bit about, me and Marie, and definitely it's a gift. It was a gift. And so I took that, I took a very kind of scary situation and turned it around and turned it into a positive opportunity to just share and increase awareness in our communities.
That's amazing. Just when I think about 30 years old, you had no sign, the typical signs and symptoms. And so just knowing something was off, and going to the doctor. And one of the things I want to encourage our audience today and watching the replay, if you have not, men and women, if you have not been to your primary care provider in the last 6 months, don't delay. Schedule today.
Yeah.
Because as you're hearing a personal trainer, dancer, okay, dancer, no typical signs of symptoms of cardiovascular disease, and you had what percent blockage, Essence?
98 and 95% blockage in two arteries.
And so here's a clear message. We can look well enough to live, and unfortunately, we can be sick enough to die.
Mm-hmm.
She had no idea, but something prompted her to go to the doctor. And so that is one of our resonating messages this morning, is for you to make sure, do not, I repeat, do not, because what I've seen in the workforce in my 30 years of serving in state government is that we're some dedicated folks, okay? We don't want to let our teams down. All these mandatory meetings, we will push off and put back our medical appointments because we got to be at that meeting. So I
It's
just want
so
to encourage you all. Go ahead.
I said that is so true that, especially women, we're going to do all the things and make sure we check all the boxes. We will make and
Mhm.
schedule the appointments for everyone else, but ours will be delayed because we have just that one more thing that needs to be done, right? One more meeting, one more task. And after that, we'll get it done, right? And so we
Yeah,
encourage, our
to our
girls.
detriment. And so that is
Yeah.
one power. Do not know where we are in our health unless we go and find out. So, Essence, you've reached over 10,000 girls across multiple cities. Now, and I know because when I work with young people, I'm like, oh, goodness, these little youngsters keep me young, right? What have these young ladies taught you?
I love that question. Every day that we are with our girls in the community at their schools, whether it's, I'm learning that you're never too
Uh-huh.
young to learn about your heart health, your overall
Uh-huh.
wellness. They kind of taught me that it's about too. So that's why we incorporate so many fun activities with them because they're so lively and so they're so impactable. And so I oftentimes have to remember the things I say to them and how it can impact them in the long run. And I heard them say, come back and Miss Essence, it's been 4 weeks. I went home and I shared the recipe with my mom. I made the fruit kebabs,
Uh-huh.
for a snack. So I get to hear all these, just how important it is to share what you learn, to share it
Uh-huh.
with your family, right? Because sometimes I learn that our girls, they know if it's cool enough or if they should share it or if, they should go home and tell someone in their family that they love to stop smoking. But we empower them to do that. And so, I've learned that one girl, we're changing the entire community. We're changing her family. And so
Yes.
that's something that we really, focus on. It's something that I've learned just from working with them.
Yeah, they're gonna take it back. So they're your biggest champions, your biggest advocates. Y'all gonna try this. So, just thinking about the influence that they have and not even recognizing that just through these daily things or through these initiatives and through your program and how you're showing up with the young ladies, that they're becoming leaders,
Mhm.
right? Because they're leading in their households with this new information. May not even
Yeah.
think about it like that. So I really got excited, just continuously around. Like when I pull up and see every week you all are doing something amazing in the community. So if I could ask you this, we often hear about heart disease affecting older adults, and you've talked about that. What should families know that many people really don't realize when it comes to heart disease?
Yeah. Families, number one, they don't know about heart disease. I mean, it's just that simple, you know?
Yeah.
They don't even know. Yeah. They don't know that heart disease is their number one threat in the community. They don't know it. And so that obviously is a big part of what we do is the education component, right? They
Uh-huh.
don't know that they can prevent heart disease.
Uh-huh.
That's number
Uh-huh.
two. And number three, even dealing with our girls, they don't realize that a choice or a health choice they make today will impact them as adults. And the adults don't know either, right? So that sometimes is very alarming. 15 can impact us when we're 35, 45,
Uh-huh.
and so forth.
Uh-huh. Uh-huh.
So we talk a lot about, yeah, the smokers. If you smoke,
Uh-huh.
right, and say maybe, yeah, you stopped, but it's still going to impact you in form,
Uh-huh.
or fashion. And so those things, they don't talk about it in the household.
Uh-huh.
Not talking about heart health. They're not talking about the healthy choices. That things are like so important. We talk about it. We need to talk about our family. We have a fun exercise where the girls bring home a family tree. And basically, this tree is all about highlighting those in the family that may have had any risk factors or cardiovascular disease. So, and we ask them to talk to them about it. Sometimes they'll kind of have it, right? Because
Uh-huh.
genetics plays a huge role in vascular care as well. So yeah, lots of interest. It's sometimes like a big wow moment when we talk, and they don't necessarily realize the impact of heart disease. We're not talking about our hearts until it's too late, right?
Mm-hmm.
It
Mm-hmm.
says now we have to do something because we now have before they so that's something that we love to push and we focus on in the program is let's have that talk, right? Let's have a heart talk over time.
Do you all ever have, do you all send information home with the young ladies, or do you all have events where the parents actually are part of it so that, I know the young ladies are sharing, but do you all have opportunities where the parents or caregivers can actually come and be a part of some sessions or some, work that you all are doing?
Yes, definitely. So the first part is we have ABCs about the heart coloring book, and it's on sale on Amazon. So you can visit there if you are interested in purchasing or getting a copy for someone in your family. But we give them, they get to take those activity sheets home and share it with their families. And then in the caregivers, the girls can speak to the things that they have or whatever the time frame is of the program, and of all the things that our girls have learned, from hands only CPR. They're learning the importance of nutrition. They're
Mm-hmm.
even sharing healthy fruit and veggies that they tried in the program for the time, exercise activities that they're just starting to engage in. It's just really a great opportunity for us to share with parents, the faculty, all the teachers and staff. So their role, they receive a kit, they receive the recognition. And so their role is to continue the message on about what they've learned to make a healthier community. So we often family that can do families. So that's also really fun with that girl's family.
That's amazing. Yeah, to become, not only am I learning, but I have an opportunity to be an ambassador so that now I can contribute back to my community, back to my family. And so, in terms of your the programs Heart and Hands, and you across several cities, right? Several cities. And if someone or organization or a school, and I have a couple of, Mississippi uh, partners, nonprofits that I've reached out to, so I can set up a conversation because we're in the same place as New Orleans when it comes to cardiovascular health. And so there is no sense in reinventing the wheel. There is no sense in starting from scratch, working in collaboration and partnerships. So with the Heart and Hands program, if someone wants more information, how can I get this? Because you're in schools, you're actually in schools. Talk to us about that for organizations and individuals who are on here, like, I want to bring this to my school.
When you reach out directly to me, as I mentioned, everything is on our website. So heartandhands.org are very interested in partnering with schools and other nonprofit organizations that focus on girls' wellness and girls' overall health. So right now we have chapters in Orleans, of course, our headquarter location.
Mhm.
We're in Austin, Dallas, and Texas. Atlanta, Georgia. We're in Nashville, Tennessee,
Wow.
and then we recently launched in Wales in the UK. A country that reach out to I'm real across interest a Heart and Hands chapter in my location. And so we you through the whole training and everything about heart. So we would take, a guided curriculum and stuff to launch a chapter, and also have tools and resources to use in the actual schools as well. So we are developing a trainer program where if you're interested in bringing a component of Heart and Hands to already baked program, you can reach out to us,
Mhm.
and we will actually give you the resources, the toolkit to bring that information into the school. So that's a few ways that you can get involved, with Heart and Hands in other locations. We're excited about coming to Mississippi.
Yes, I'm very excited because, again, we're neighbors for one, and number two, there is no sense in reinventing the wheel. And so we know that the more that we do in community with collective partnerships, that is where the work is done, right? It is truly done in community. You
Mhm.
already have the resources available, the trainer being a guided curriculum. And so we're just very excited. And so as you all are listening, Orleans or in Texas or in Atlanta. So that is amazing. That is huge to be able to have impact across states, right? Not just cities like, oh, we're in, Lafayette. No. You're across states, sending this message at a very early age when it comes to heart health and young people. Again, we're talking with Essence Banks, founder and CEO of Heart and Hands out of New Orleans, Louisiana. Heart and Hand focuses on young girls and young adults ages 10 through 18, educating, bringing awareness so that we can prevent cardiovascular diseases later on in life. Essence, you do a lot. You champion a lot. How do you, as the founder, CEO, cardiac thriver, navigate and have harmony or balance with those roles and responsibilities and taking care of yourself?
Yeah, I've learned, rather quickly that taking care of myself was the most important thing, because if I don't take care of my health, and myself, then I can't help others and I can't be good to anyone. So, I've learned to set boundaries. I've learned to say no, right? That I can't join all these clubs and organizations and be at all the things all the time. And
Mhm.
so I definitely have prioritized my health as a result of this. And, with our program, they are teaching me even more about things that I can do, right? To have fun and take care of my heart health too. So that young generation really is innovative, and they're really cool, showing me different techniques that are all on YouTube, line resources that we never had before. So it's really cool to kind of to do that. So I really take that to heart and have to my heart health and
Mhm.
taking care of myself. The boundaries, I think, is a big thing. Ensuring that,
Okay.
the way that I work, the way that I set up, the organization, the way I work with the teams and the volunteers, to help the organization so that I don't have to do all of the work, right? Ensuring that I'm delegating and working smarter. That's a huge piece, is
Yes.
harder, not harder,
Yes.
to get things done. And, I'm still learning. I'm still learning and still growing, but those are some things that I really try to prioritize, in my work.
That's excellent. That is excellent because we can quickly think if they don't do it like I do it, and I'll just make sure I handle it. And then we run into burnout, even though you love
Yeah.
what you're doing. Let's not do that. And so I thank you for acknowledging that there are people around me who are just as capable of carrying this out so that I can take care of myself. If we're having this
Mhm.
conversation 5 years from now, what impact do you hope Heart and Hands would have made?
Oh my goodness, I love that. Feel one would be obviously right now more girls to populate expand our reach to more cities. So to really the amount of cities and areas that we're in to expand that
Mm-hmm.
reach. Also to ensure that heart disease, right now 1 in 3 women will die from heart disease every year. And I'm hoping with the work that we do, we could change that number, that it won't be the number one killer of women and men, in our community. So hoping that the work that we do can impact the larger, ecosystem. And when we think about the whole community, right, just really ensuring that that information trickles down and helps to change that, that number. Because I think that because we're encouraging girls to live healthier lifestyles, right? Make those healthier and things that they can do now so that they don't have to succumb to heart disease or any other form of cardiovascular disease in their lifetime. And then just the access to healthcare and healthcare information, healthcare resources. In the next 5 years, we want to be the leader, provide information for one this age group and then
Mm-hmm.
their families as we're creating generational health. I think the big two really want to focus on to help change how heart disease looks, 5 years from.
Mm-hmm. That's excellent. That is excellent. Generational health. We often talk about generational
Mhm.
wealth. You can be wealthy and unwell, you will not enjoy your wealth. And so I love how you just really, really phrased that we are creating, it is our aim to arm our community so they can have generational health. And so I have one final question for you before we come back around, and I want you to share more about your upcoming events. If every woman and girl listening today could hear one message from your heart, what would you want them to know?
Wow. It would be to listen to your heart. Listen to your heart every day, right? We don't place enough emphasis on our heart. We go to the doctor to get so many other things checked, but we never just slow down, take a moment to just connect with our hearts, right? Whether that's, mindful breathing or like putting our hand on our heart and just really being thankful for the work that the heart is doing for the entire body. And I ask women and girls all the time, what did you do for your heart today? Simple question is so because I often get a blank stare. Like, what do you mean? What did I do for my heart today? Well, when you woke up, did you stretch? Did you drink water? Did you tell your heart thank you? Right? Did you have a moment to breathe? There's so many things that we can do, each day. And the that's what Heart and Hands really is about. It's like the reason why the name is Heart and Hands is because we want you to take your heart in your hands. We are responsible for our heart health, right? And so women and girls, we are in charge of our heart and we need to ensure that we're taking care of it every day, not just when something's wrong, right? Not just when we're feeling something that's off, to take care of feel. We need to go to the doctor immediately. We say it's something else because as women, sometimes we'll do that, right? We'll say, oh, maybe I didn't get enough sleep. Maybe I'm stressed. It can be a list of things, but you need to go to the doctor and just get checked so you can know your numbers. We do a lot of work around knowing your numbers, right? Those important, risk factors for heart disease. Most of us don't know them, but that is also something that I would say, as far as like taking your heart health in your hands, is knowing your own numbers so that you can make decisions that are best for you, right? It's not what's best for me or the doctor. The numbers that you have are your numbers alone. And so it's very important for us to take heed and pay attention to those, pay attention to our hearts and just really love our heart every day.
Essence Banks, founder and CEO of Heart and Hands out of New Orleans, Louisiana. Organization nonprofit with a focus on young girls 10 to 18 across multiple states, delivering support and technical assistance. So if you, your school, your nonprofit organization is interested in this wellness piece, make sure you connect with Essence Banks of Heart and Hands. It is our charge today and our invitation to you to take your heart in your hands. I love that message, Essence. Thank you so much for being here on this Figured Out Friday, because we shall not figure it out alone. And I want to ask you before we close out to also come back around and share two very important events that you have coming up at the end of the year that helps to promote and support your programs. And so they're beautiful events. I'm going to be a part of. Well, I've already nominated myself to be a part of championing and supporting. I'll definitely be in New Orleans. So thank you for the invitation for the gala. I will definitely be at the 5K, 10K. I'm very excited about that. Gonna get a little team. So I'm just gonna be promoting because that's how we do this thing. And so if you'll share specifically about your upcoming events, we'll love to close out on that.
Awesome. So thank you so much again for having me today. I love this Figure It Out Friday. I love that phrase. So Heart and Hands has several events throughout the year, but one of our flagship and signature programs is our Love Your Heart Gala, and that will be September 12th, Saturday, September 12th, here in New Orleans at the Ritz-Carlton New Orleans Hotel on Canal Street. And we will start with a VIP reception at 6 to 7, and then 7 until 10 p.m. We will have our very spirited gala where we are acknowledging and recognizing and thanking our young people, our girls that are in our programs for the work that they have done. We have so many girls that are dedicated every day to improving their heart health. So you'll see a little bit of that at the gala, as well as highlighting our junior board members and our overall work that we've done throughout the year. So I think it's always going to be a great time. And then in November, we will come back around with our signature Running for the Heart 5K. This is our 5th year. We have a 5K, 10K, and you can also join virtually. So if you visit our website as well, the link is there. You can register. You can register and sign up a group if you like, which we have different rates for groups. But it really is a great time to come out. It's a fun run, walk. As I mentioned, you can roll, you can stroll, you can jog, right? It's open to all levels, but we're running along the water, on along the bayou near City Park in New Orleans. So it definitely is a very fun time. We hope the weather will be great, but I want you all to come out and be a part of this event. And if you want to do it virtually, you have the full weekend to complete that 5K, 10K as well. And with this event, you do receive a signature t-shirt, the signature bib, as well as a medal. So I know we love our medals.
We love our medals.
That's right. So hope to see you all out there. Support any other, of our future events that we have coming up in the future.
And Essence, what are your social handles? How can people keep up and stay with Heart in Hands?
Yes, let's go. Pull out your phones. We're on Instagram, so we're Heart and Hands NOLA. And then
Mhm.
all of the other cities are Heart and Hands Atlanta. So Heart and Hands ATL, Heart and Hands Inc., Heart and Hands Wales, right? So you can follow us on Instagram. We're also on Facebook. You can find us on
Mhm.
LinkedIn. So yeah, follow us on social, pull out your phones. You can also visit our website, which is www.heartinhands with an s.org. Follow us there, and all of our social handles are also on the website as well. If you want to reach out to us, send me a special note about today or ask any questions, need more resources or information, I am here. You can email me personally at essence@heartinhands.org. We would love to hear from you. Again, if there's any more information that you would like, that you need, please feel free to reach out to Heart and Hands.
Again, it has been my pleasure to have Essence Banks, CEO and founder of Heart and Hands, nonprofit organization focusing on young girls ages 10 through 18 with regard to cardiovascular health in a fun way. The organization spans across 6 states and now has an international chapter. If you or your organization, nonprofit, school, or community group is interested in having a chapter in your city, please make sure you reach out to Essence, her socials, Heart in Hands NOLA, or Essence Banks on her social media handles. We're so excited. In order for us to prevent chronic health conditions, we've got to start early and teach our young people. It has been my absolute pleasure. If you want to be a part of the upcoming events, two major events, and I'm going to say this again because I know my Facebook people did not have a chance to see you, but they're still hanging out over here. Thank y'all, Facebook. If you want to have an opportunity to support, dress up, and support the gala September the 12th, Heart and Hands Gala September the 12th. Put on your best dress and hang out in New Orleans. You can ask for a better location, a better environment to be encouraged and to focus on the young girls. That's the message. You're gonna uplift and focus on the young girls. And whether you're a walker, a jogger, a roller, 10K, 5K, and a virtual event coming up also November the 7th. Make sure we're pulling up and plugging in to Heart and Hands. Our opportunity to recover the recoverable because our heart is in our hands. Essence Banks, thank you so much for pulling up this morning. We're going to definitely have you back well before September so that we can keep promoting and raising awareness, but also promote your upcoming event. Everybody, Facebook, LinkedIn, YouTube, as well as Instagram, we're so grateful for you pulling up. Make sure you share this out so that others can learn about Heart and Hands and the fact that there is an organization specifically targeting young girls ages 10 through 18 when we know that cardiovascular disease is the number one killer of African American men and women in the United States. If you can do one thing today to mitigate some cardiovascular issues, June is National Dairy Month. I invite you to dump dairy for the month of June, and here's why. Dairy is the number one source of saturated fat in the American diet. Saturated fat is the leading cause that contributes to clogged arteries. So if you want to prevent cardiovascular disease, high cholesterol, there's your one thing that you can do for the next 30 days. Thank you so much. Y'all know I'm gonna drop you a freebie on a Friday, every Friday. And so we really want to do what we can to help as many people as we can. Like Essence said before I get out of here, people don't know. We're not having heart to heart conversations. Keep pulling up 6 o'clock a.m. Central Standard Time every Friday for Figured Out Friday in the Coaches Cafe. Make sure next Thursday you pull up 90.1 WMPR. I will be live in the studio on My Health, My Mississippi, continuing partnerships, continuing having these conversations because, again, we can recover the recoverable. And we do that in community. You all have a beautiful weekend. Take that one nugget, just one thing, not 10 things, and do one thing that is going to love your heart this weekend and for the next 30 days. For the next 30 days, do something. That's your heart challenge for the next 30 days. Thank y'all so much. Facebook, I'm going to say sayonara, goodbye. I will see y'all later. YouTube, LinkedIn, as well as Instagram. Thank y'all for pulling up. Thank you for the comments in the chat. We are going to sign off now. Thank y'all so much for pulling up with us.